Good morning. This is February 2nd, 2021 at 9 a.m. and we are calling the Health Committee to order. Amanda, would you please call the roll?
Ball,
Here.
Kokenauer,
Present.
Curtis,
Yes.
Seymour,
Present.
Alden,
Here. May I have a, thanks. Wait. All in favor, say aye.
Aye.
Reserve of- All right. May I have a motion, has everyone gotten the claims in their email and gone over them? Okay, can I have a motion to approve the claims? Roger, a second? Second?
I'll second
Okay, any discussion on it?
Bard,
it. Yes.
Kokenauer,
Yes.
Curtis,
Yes.
Seymour,
Yes.
Alden,
Yes. Any public comments? All right, we have Dr. Youssef with us. Is that Zoom or phone? On Zoom. Good morning, Dr. Youssef.
Yeah, can I start?
yes, you can start.
Okay, good morning, everybody. Barbara and John, thank you very much for giving me this chance to attend the meeting through the Zoom. So actually, last month, January, we received 9 dogs, 5 cats, 1 cat. We sent it to the lab and came back negative for rabies. Everything is doing very well. We have reasonable cases. We have 1 animal officer so far. Linda was looking for another 1 as a support. So hopefully we find a new one very soon.
Okay, any questions for Dr. Youssef?
I do.
Okay, we have 1.
I don't know if he's gonna be able to hear me or not. On page 1 of his report, it listed he had $92.10 in tolls for a Wisconsin dog pickup. Page 2 lists $1,888.19 for a monthly fee and services for animal control. But what Dr. Youssef submitted in pages 5 and 7 say there was a charge for $1,660. So something, I don't know if there's an explanation, I'm sure there is. Something's not adding up there very well, I don't know what it was.
Well, the tolls was from the Hall case that got settled, later in the year, last year. And they reimbursed, had to pay their fines and all the monies back for the expenses to deal with, that case and having to go get their dog. So the tolls were from going to Wisconsin for, picking up the dog to return back to Halls, and that reimbursement's already been received. It's just that Linda just now got the bill for the tolls.
Okay, but if you add the 1660 and the 9210, it doesn't come up to 1888, so I guess something's not, I guess I'm confused.
Oh, okay, I see what you're saying, and then, because you're looking on the claims report,
Yes.
that's the total there, the 1888.19, so that's gonna include his fees and services, as well as he had some UPS charges on there.
Okay.
It's not broken down by line item, it's just the total amount paid to him,
I'm sure
so,
there was a good explanation, I just,
Yeah.
it wasn't adding up. So.
yeah.
Okay,
Sorry, Dr. Youssef, I just fielded that one for you.
that's fine,
Yeah, thank you.
thank you.
Any more questions? All right, thank you, Dr. Youssef.
All right, thank you.
Thank you
All
very
right,
much.
we'll have a report
Bye-bye.
now from Dee Shepherd from the Iroquois County Public Health Department.
Good morning.
Morning.
I'm going to give you your program summary report first, and we'll kind of go over that. And then we'll talk COVID.
Do we have to?
No, yeah, I would like not to either. Thank you. I've talked COVID now for, 10 months straight, and I've had it up to here. 50 phone calls a day to my home phone or my personal phone, plus all the calls at the health department, plus all the emails, plus now all the Facebook stuff. It's getting kind of nutty out there. It's more than nutty.
Goodbye.
Okay, so on your summary report programs, I want to keep in mind that even though we're still in the midst of COVID cases where we're doing our disease investigations and contact tracing, which our numbers are down, which is good. Over the weekend and including yesterday, we only had 7, so that's really good. It's still a lot of work when you think 7 cases, and if each one of them has 10 people that they were in contact with. And I do think that now we're seeing a bigger increase in the number of contacts because a lot of the state mitigations have been lifted, and so people are out in the community more, people are socializing more. So of course, every time we have a case now, we're gonna see more contacts directly related to that case. So you have to keep in mind that just say the average person had 10 contacts, that's still 70 people that we put into quarantine, you know? It's still a lot of work. On top of that, we're now doing the mass vaccinations, and that's a tremendous amount of work. All on top of all these normal, regular health department programs and services. I think the staff is doing an amazing job. They are putting in some long hours. Still, we don't see the light at the end of the tunnel for that. You know, last week, I know Eric and I were at the hospital, at clinics, or either here in the office until at least 9:30 almost every night. So we're putting in some long hours, and we're doing the best that we can. We know that there are a lot of community members that are frustrated right now, especially those who are waiting for vaccines. We are given a 24-hour notice before a vaccine comes in through eye care. We even had one where we didn't get the ship. So when it goes into eye care, we can see different phases. So we'll see that what we requested was approved, okay? But we can only request what they allot to us. So let's say that our weekly allotment is 300 doses, which has pretty much been our average. We can request 300 or less. We can request more, but we're not going to get it. So at least at this point, we haven't gotten anything. And every week we put that we need more. So we'll get a notice that that's approved, and then we'll get a shipping notice, and then the vaccine will arrive the next day from the shipping notice. We've actually had vaccine in hand and have not had the shipping notice yet. So it's been challenging at best, but we've been told that we will start getting weekly shipments. You know, there for a while we were getting bi-weekly shipments. Now we're told that we'll be getting weekly shipments. So we hope that that's the case, and we hope that the allotment increases very quickly. So if some of you guys, and some of you do remember, back in 2009 when we had H1N1, and they gave health department doses of H1N1 to distribute it to the community members, they started out saying that it was for people 70 and older. And we had a lot of people in the community that wanted that. That was a very critical time as well. And we tried the wait list thing. I was the communicable disease coordinator at the time, so we tried the wait list, putting people on a wait list. That does not work. In fact, Champaign County has abandoned their wait list. I think Vermilion County has abandoned their wait list. I could have told them that. I'm not, because I've been there and done that. Wait lists don't work for lots of reasons. Here's why. If you put someone on a wait list, they're going to assume that they're going to get a call within the next few weeks or month. We do not want people on wait lists for 3-4 months, and that could happen. When you're only getting 300 doses a week, and we also have to service the other entities in phase 1B, for example, the teachers, the postal workers, the other entities listed in phase 1B, as well as those 65 and older. There's not going to be a lot of vaccine for people. So some of these people are gonna be on wait lists. When you're on a wait list for a long time, you tend to call into the health department to find out where you're at on that wait list. We cannot have hundreds and hundreds and hundreds of people calling in the health department every day just to see where they're at on a wait list. That's not feasible for us. It prevents us from doing our other services. And I don't think that it's fair to put a taxpayer burden on people and start hiring people just to answer that question. The other thing is, if you have a wait list, and once you start calling people, even if they answer the phone, there are going to be people that want that it's not a convenient time. They want you to call them back and they want you to hold the dose for them. That doesn't work, because then you're holding a dose for somebody that may or may not call you back. Okay, and they just assume that you held it, so then they show up at the clinic anyway. That doesn't work. The other thing that happens is, as you start to call people, there are going to be people that are in the shower, that are at work, that are in the grocery store. They're going to miss their call. So we're going to move on to the next person, right? Well, then that person's going to call, and they're going to be mad that we weren't able, because we called them at the wrong time. Here's another thing that happens when you have a wait list, and this is the one that worries me the most. Once you start calling people to say that we've got vaccine in, they start calling all their family and friends. Their family and friends start inundating the health department. And we can't get lines out to call the people who are on the list. It's a nightmare. Trust me. Been there, done that. It sounds good. But logistically, it is a horrible mess for a health department to try to get into. Now, I realize that Kankakee is doing it, and they're setting up through the MyChart for Riverside. But I don't want to do anything like that. I don't want to force Iroquois County residents to have to sign up with a specific entity and put all of their personal health information for that to an entity that may or may not be their primary care physician. I don't think it's right to force people, in order to make an appointment, to go with one specific hospital group or entity. I don't think that's okay. So that's just my opinion. So there are lots of reasons why we're not doing this wait list thing. Now, we had planned for months that we were going to use the state M-Track system. It's called EM-Track. That system has many, many flaws. We tried it.
You want me to stop?
You can expand on that a little bit.
We tried that with one of our first dose clinics last week, and it had a few benefits, but it had too many faults, and it probably works better for jurisdictions or for operations larger or more outreaching than what Iroquois County's mission is. But for our purposes, it overcomplicated our point of dispensing process, so we're not going to use that anymore. A lot of the benefits that we were hoping for did not work out, including less paperwork. We did not have any less paperwork, and online scheduling did not work out either. So those features that we were hoping for did not come about. So we're sticking to our paper-based system, which is solid. And we're still able to get people through our point of dispensing within half an hour to 45 minutes, so it's good.
One of the things that happened with our EM-Track system, just to give you an idea, was Eric and I set it up. We tested it at like 10 o'clock at night on a Tuesday night. Wednesday, we get ready to take appointments. He comes in at like 7:30 in the morning. He gets into the EM-Track system, and we had 250 doses available. 141 of them were filled, and most of them were out-of-state people. People that were willing to drive from Missouri, Iowa, all over. But the link to that system was unpublished. It was an unpublished link that we had set up with the state. There are people that are good enough on the computer that they can find those things. Now, I'm not good enough to find those things, but there are people that are. And then they start telling all their family and friends, and they filled up from out of state. We had people that were, so we had to cancel all those appointments, right? We had people that called in that were very angry about that. And people from Missouri that, this guy was planning on, he'd already called his boss and was going to take the day off work to drive his parents up, People were angry when we explained to them that our doses are for Iroquois County residents. One of the reasons that I have stuck by that, not all, every county has an option to distribute, to distribute according to the Illinois Mass Vaccination Plan, which is phase 1B. But we don't have to limit it to our county if we don't want to. But we're not charging in Iroquois County for this vaccine. A lot of counties are taking insurance information and they're billing for the administration fee. We are not doing that. We are financially prepared. We were financially prepared for a pandemic. You know, I've been talking to you guys about that for years, right? We planned for that. I'm not charging for people. I don't want people who can't afford it or don't have insurance or whose insurance doesn't cover it, or because we're at the beginning of the year, haven't met their deductible, to have to not get it because of the cost. So we are not charging for that. Well, so since we're not charging for that, I feel like because we are Iroquois County taxpayer supported, that those people in Iroquois County should absolutely have first bids to those vaccines. So that's one of the reasons why we're not doing that. Now, I have made exceptions for people who work full-time in Iroquois County. Because obviously they work here, they shop here, they are exposing our community. So, but those are the only exceptions that I have made. And I'll give you the teachers, for example. You know, we have a teacher that might live in Vermillion County, but teaches full-time, you know, at Watseka High School or at Iroquois West or at Clifton if they live in Kankakee. We've made sure that they're exposing our students, so we make sure that we include them as well. But there are a lot of downside to the way that we do it as well, and I realize that. I sent out a press release telling individuals that what we will do is on the days where we have vaccine available to schedule. So here's how this works. We get our vaccine in, and then I call IMH, I talk to them, we arrange a clinic, and then as soon as that's arranged, the very next day at 11 o'clock, at 11 a.m., we will send out a press release notifying the public that doses are available and people can call in. Now, there's pros and cons to that, okay? And I realize that. It helps the community so that they're not tied to their phone all day, waiting for a call back on a wait list, or they don't have to check Facebook every 5 minutes every day. If we tell them that our press releases are going to go out at 11 a.m., then if they check and at 11 a.m. there's a press release there, they can start calling in to get on the schedule. If there's not one put out that day, if there's no press release put out that day at 11 a.m., they know that there's no vaccine available to schedule. The downside of that is we're kind of hurting our neighbors here in the building. Our phone lines get so overwhelmed that they can't get an outgoing line. And I don't know how to fix that. I think Jill was looking into that. Did you find?
It just happened the one time.
It's gonna keep happening though.
Yeah, and that's something I talked to Jeff about, and he's gonna get together some different options that we can look at if we want to.
Over the last couple of months, Iroquois County Public Health Department has added 10 new phone lines into our health department. So when we have a press release, let's say we have 250 doses available to the public, and I have 15 people on phones, and they're each taking, you know, the first 15 appointments, you know, it doesn't take long. We actually filled our last clinic up with 250 doses within 25 minutes. But when you got 15 people answering the phone, we can do it pretty quickly. And now that we're not using the state system, we don't have to get people's email addresses or their physical addresses. We're just getting their name and their phone number and putting them on the schedule. So it goes really fast. The downside of that is if somebody's tied up at 11 o'clock, he doesn't jump on until 11:10 and see the post. By the time they're calling in, they're going to hit a busy signal, because we're getting hundreds and hundreds and hundreds of calls. But that's the best way we can do it right now. It's the most fair way. People say, well, that's like kind of like trying to win a radio contest. Well, yeah, it kind of is. I mean, I don't. There's no better way to schedule people that's fair to do it that way without doing that wait list, which is a nightmare. So we're doing the best we can. And like I said, I don't want to tie somebody to using a hospital my chart or something like that in Iroquois County. I'm not comfortable with that. So if you think of a better way, I promise you, I'll listen to any suggestions. I don't think I've got it all figured out by any means, but this is the best way to do it for now. It is stressful for people who call and call and call, and then finally somebody picks up and they're so excited, and we say, we just ran out of the appointment slots. You know, that's hard on people. But if you look at the population of Iroquois County, we have a population of just under 28,000. We know that 24% of those people are over the age of 65. Now, the state average is 13% of people are over the age of 65. So that tells you that we are an aging community. So if 24% of people are over the age of 65 out of that almost 28,000, we're talking about 7,000 people. If you're only getting 300 doses a week, think how long that's going to take and how frustrated people are calling in. So I absolutely understand their frustration. People cry. We have people that, at any given moment, I can walk in while we're doing appointments, and I take them myself too, but I could walk into the other rooms and somebody's crying on the phone with one of the nurses and the doctor crying too, you know? We feel for these people. This is our community too. We live here too. We've raised our families here. This is our home. We care. We love our neighbors. We love our people. You don't work in public health. Trust me. You do not work in public health unless you care about your people. Because they're not getting rich working in public health. It's not a secret that most of my nurses could go to the hospital and make a lot of money. That's not a secret. They do this because they love it. And believe me, they don't do it because they get weekends and holidays off, because there's not one of us that's had any time off since March, hardly. We did close the health department on Thanksgiving Day. We did close on Christmas Day. We did close on New Year's Day. I did close us down and tell them, don't investigate cases, don't, because at some point we all need a break. But they're working every Saturday and Sunday. They're, everybody's working. They're doing the best that they can. And I realize we're kind of the most hated people right now in the county, because people think we're hoarding doses. We're not hoarding doses. Nor are we picking and choosing who gets the vaccine. Yeah.
Well, do you see a point in time when we're going to get more than 300?
Yeah. I think that's coming. They told us that vaccine allotments will pick up in the coming weeks, and I think it's going to happen.
Yeah, you said about 20%.
Yeah, well, we know that we were told was it Friday?
Yeah.
Friday, that this week's allotment that after this week's allotment, because last week, is the allotment for this week, gets shipped Friday, gets here probably yesterday, probably today. We think next week, they told us that 20% increase. So that's good.
We're dealing with international supply issues.
Yeah.
Everybody in the world wants COVID-19 vaccine. Different countries are using different vaccines, and at least all of the United States of America wants Moderna and Pfizer. So, whenever we get it, that shouldn't be pushed out in a hurry.
John, another thing that I've been told is that hopefully within the next month, it will not only go to health departments, it will also go to local pharmacies. That gives people a chance to go to CVS or Walmart or Walgreens or wherever they want to go and get it too. And we're okay with that. We're definitely okay with that. This is a stressful time for people who want it, because they see this as their ticket to freedom, to be able to go out and go back to social gatherings and have their family gatherings and have their grandchildren come and see them and have their, their family weddings and be able to go to a funeral and say goodbye to somebody that they've known all their lives and loved. We get that. We do. We get it.
So getting this vaccine, does that guarantee that you won't get COVID? Or if you get COVID, it won't be as bad?
Well, they're telling us that the efficacy rate is over 95%. So you're not considered immune until after your second dose, and it takes about 2 weeks after your second dose to achieve an antibody level that's high enough to protect you. So they're telling us that it's going to take at least 2 weeks after your second dose before you can achieve immunity. right now, we don't honestly know how long that immunity will last. Will you need a vaccine every year? Will you need one every 5 years, like a pneumonia shot? We don't know. It hasn't been out long enough to know that. So, you know, we just tell people the information that we have and go from there. But at least it will. We know that they'll be immune for a while. So, at least it'll give them some freedom for a while.
Yes, I was exposed, and I think it'd been about 12, 13 days after I got my second shot. And this individual was from Kankakee County, and I said I had both shots and I'd gotten the last one at such and so date. Well, there's a 95% chance that you won't get it, but there's a 5% chance that you will get it. So you're isolated, and that was that. So then I informed your department here. Now there's a difference. They said I had to be isolated for 2 weeks, and here they said for
10 days.
10 days.
Okay, so that's a good point, Roger. The state of Illinois, IDPH, is allowing each county the option of doing a 10-day or a 14-day quarantine period. Based on all the studies that we have researched, there's a very, very, very low rate of people who become positive in day 11, 12, 13, 14. So we opted to go with the 10-day quarantine period. So we now have a 10-day isolation period for those who test positive and a 10-day quarantine period for those who are exposed. But there are counties that still have the 14-day quarantine period, and they are basing that on, you know, they have lots of different rationale for that as well. I researched it, and to my knowledge, I went back and I looked at our cases. How many people got sick with COVID or tested positive on day 11, 12, 13? And it was so low that I thought, let's let these people out of quarantine earlier. It's almost unheard of. But there is a chance. So do you err on the side of caution, or do you let people go about their lives? So I chose to, normally I'm always the error on the side of caution girl. You can ask my staff, always err on the side of caution. But I decided that risk was so low that we might as well let those people out of quarantine. They're not sick. They didn't get COVID. They didn't test positive. They were just exposed to somebody. So let them go. And at any given moment, you can walk and talk with anybody that has been exposed. Okay, so I decided to let them out of quarantine at the 10-day period. Was that the right decision? I still think it was.
Yeah, they got groceries for me, but they wouldn't bring me the booze that I wanted.
Yeah.
We're happy to buy your groceries if you're in quarantine. We don't buy alcohol or tobacco or, you know, steaks. No, people ask for prime rib and stuff. Nah. That's not really considered an essential to get you by.
Do you have any other questions for Dee today? Anything more to report on? Well, we thank you very much.
Thank you.
We thank you and your staff for all that you're doing.
Yeah,
Thanks. We've given over 2,000 doses so far, so we're getting there.
Yep. Very good.
We're getting there.
All right, any old business today? New business? May I have a motion to adjourn? If you guys want to stay? Second? All in favor, say aye.
I
Opposed? And we are adjourned.